Good morning, warriors. I want to welcome here today Dr. Sharon Sommers. Hi, good morning.
Good morning. I hope everybody is doing well. Thank you for having me.
Welcome to another episode of What's Up, Doc. It's a chance to ask questions about um, your practice, about how to help people that are going through this incredible journey.
Yeah.
Please tell me a little bit about yourself.
Okay, well, that's a big and great question. I live in New York City. I'm a clinical psychologist. I've been in private practice now about over 20 years. Um, I'm married. I have two children, 24 and 28. So they're sort of
On their own.
flew the nest. Yes. And I had my own journey with, infertility way back in, even way before many of this, all the sort of new stuff has come out. So I was helped with assisted reproductive technology myself. So I kind of understand that journey. And, I let's see, I'll say some personal things about myself. I'm a knitter. I love to knit. I find it very relaxing. I think that, doing something with your hands, it can be help a lot with anxiety. I encourage my patients to do that. I like to play tennis. I like to hike. I love nature.
Is is
Um,
is is that what got you into the path of helping couples on the fertility journey? The fact that you went through it yourself and that you know the trials and tribulations of the process and
I think
how it could really
partly,
affect that
yeah,
family connect.
yeah. I'm sorry. Yeah, yeah, I think so. I think partly was that. Partly it was kind of just a natural um, evolution that happened within my practice. I think I always like to say this, my patients teach me. So I had a, a series of patients who came with various issues with fertility, family building, and it really sparked my interest. And it had to do, it kind of connected me with my own history. So I decided to learn more about it and take some courses through ASRM, the American Society for Reproductive Medicine, and really, just learn more from the ground up about it.
What are some of the things that you see most that couples are going through when they start this process?
Yeah, that's a very good question. I mean, I think just a lot of fear and um, worry. Will we be able to have the family we want?
Affordability,
Um,
can we afford it?
Affordability for sure, and just the sort of the process of getting like a cog in the medical wheel. That um, feeling like a hamster on a wheel with all of the appointments and the just managing the sort
I
of
think it's the whole, you know, I think, growing up, this was not a path any of us ever imagined,
mm-mm,
ever. I
right,
mean, we always kind of thought, oh, you meet someone, you fall, or however you choose to, but,
right.
you make love, you have a baby, and you have
That's
a
right.
family. And that's kind of how I think that was
Yeah,
always ingrained, how this was all going to go down. And now all of
that's
a
right.
sudden, I think being faced with the fear of, will I ever be a parent?
Yeah,
Maybe the pressure from other sources about wanting to be a parent
yeah,
from the grandparents.
that's right. And
So
just the community. Yeah,
it's
it's
so
very hard.
much. So I think
Yeah,
when you get to this point, I think it's everything wrapped into it all. Like I just think the
yeah,
pressure is
yeah,
just so unbelievable. And people know on the side I always push mental health because I think mental health is so vitally important when going through this process. And I
hmm
think it's not spoken about enough.
yeah.
And I don't think it's really mandated enough. I think a lot of these clinics only mandate 1 or 2 sessions,
Yeah,
and then you move on in your journey. And I think
that's right.
it should be every part
Yeah.
of the journey.
I think the biggest issue, or one of the big issues, is isolation. The sort of, and shame. People feel this sort of like shame around I'm broken, or there's something wrong with me that needs to be fixed in this medical way. When, like you say, we're taught, or we see in the media, that it's this beautiful natural thing, and
Right.
it's sort of, now it becomes this sterile medicalized thing, and there's a lot of shame in that. And I always like the phrase, shame feeds on silence. So when you're quiet and you isolate yourself, it just gets worse. So communities like yours, or seeing a therapist, or just talking to other people who are going through it, makes such a difference.
Well, that's why when
From,
I started the group, years ago, when there really weren't many outlets to talk about it. And
yeah,
because it was even more hush hush
yeah,
back then, before celebrities started coming out and talking about infertility and going through IVF and
yeah,
everything, you know, I I just think people were just so secretive about it. And you'd go to
that's
these
right.
doctors' offices and there'd be like 30 people in a waiting room, everybody looking down.
I
And
know. Yeah,
it almost depressed me.
yeah,
And it was,
absolutely.
that part of it, until I switched locations, but that part of it was really hard. And
Yeah,
it made you feel like, yeah, I'm not alone, but oh my God, this is depressing.
yeah. It's the, you know again, that idea of there's something wrong with me, I'm broken. And just being able to have someone listen. I said this to you before. I We've lost the art of listening, just to hear what it is. And sometimes there's not an answer, sometimes there's not a fix for something. Feelings are not really to be fixed, they're just to be felt. So I think that's really helpful. And the feelings of sadness and grief. Why why can't I have what I want in the way I want it? I want a family this way. I want my own child, biological child, all this. So many layers
So
that
many
I just
layers,
think,
and I think once you kind of figure those layers out, and I think you could get a little bit clearer about
yeah,
the journey. Like I know I kind of did a 180 in terms of how I was feeling. And
mm,
instead of being upset, I said, you know what? There's plenty of doors to knock on.
yeah,
Now is the time. We're not, making love. This is now science. And now we have to
yeah,
figure out the right pieces
mhm,
of the puzzle in some way
yeah,
that work.
yeah,
And let's do it. And when I
yeah.
kind of
That's yeah,
went into
it's great.
fight mode a little bit, it kind of helped me out emotionally a little bit better to
That's
kind
right.
of
It's more
navigate.
resilient. You felt your resilience. Like, okay,
I
here,
got this.
these are the cards I've been dealt. Let me play
Right.
my hand.
That's
Yeah,
right. And
yeah,
instead of wallowing and feeling sorry, said, you know what, let's get out of that mode
yeah,
and let's kind of get into fight mode and say, okay, I can
yeah,
tackle this. And if it's not going to be this door, I'll knock on another door.
yeah,
But
yeah.
with
And
that
there are
also
many
comes,
doors.
there are
Yeah,
many doors, but again, with that comes privilege. And sometimes people
sure.
don't have the benefit of knocking on several doors. Sometimes they can
It's
only
true.
knock on one.
Yeah,
And, that's why to me, having a therapist go along someone, go with someone along this path is
yeah,
vital.
yeah, yeah. I mean, it's absolutely true that, you know, I can talk for hours about the healthcare system and what's covered and what's not. I think that's beyond the scope of our conversation today, but
No,
it,
no, I think that's a major
it's
part of it
unfortunate.
too. It is.
Yeah. It's, that, these, I mean, I think they're trying to work on reducing the costs, and more companies, more businesses, more employers are covering these services, but not enough.
Not enough for
And
what, mental health services.
for mental health, but also for the services for, assisted reproductive health, help, for the technologies. And
It's
again,
so much
marginalized
better
communities.
now. Now it's
Yeah,
better. I mean, when I was going through it, you know, they didn't have all the benefits that they have now, where it's now insurance
yeah,
companies are mandated to cover. I had all
yeah,
out of pocket. And if not for
yeah,
my parents, they helped us. But if
yeah.
not for
That's
them,
right.
we would have been in a situation like most people,
That's right.
struggling to figure out if we're going to have a chance to have a child.
Yeah,
And
it's true.
like I said, that was one of the reasons why I started the group, because I didn't want to feel alone, and I didn't want anyone else to feel like they were going down
Yeah,
this journey by themselves.
yeah,
And know that there are resources to turn to, and the right resources to turn to.
yeah, yeah.
Because there's a lot
And
of
to,
harlequins that are out there too. And
yeah,
you need to protect yourself, and you need to advocate, and you need to know time's not our friend. And
yeah,
you want to be with the right people that will help you on your journey.
right. Yeah. And I think it's, the whole time is not on our side is this. I think it's important to be honest with people,
Right.
and, oh, don't worry about it. Don't worry about it. Take your time. Yes, take your time to research and look into things and take care of yourself. But also, there is a time factor here for many of us. So, you
What
know,
are some techniques that you like to give your patients to kind of help navigate their stress that they're
yeah,
going through?
I mean,
No
they're
matter what stage, whether it's fertility or the pregnant, like
right, right. I mean, I like to use a sort of visual of buckets of tools. Um, so I think of things in terms of three buckets of tools. Bucket number one is I call that the medication bucket. Many people don't have anything in their medication bucket, but some people use medication. If you have anxiety, if you have depression, if you can't sleep, we can put some things in that bucket. And, that's a good bucket, but I don't think about putting people or suggesting people go on medication right away. I think that's just one bucket, but that's bucket number one. Bucket number two, I call the doing bucket. It's like the behavior bucket. That's like all of the things. First of all, regular exercise, regular, some kind of mindfulness or meditation, getting enough sleep, drinking enough water, seeing friends, listening to music. I
all
mean,
those things put
whatever,
together.
anything you do, right? And everybody's bucket number two has different things in it, but I like people to have a lot of things in it because not everything works all the time. But you have to find yourself for yourself. What is it that sort of makes me feel better? Reading, going to bed, the beach, whatever. So that's number two. Number three is the thinking bucket. So that's how do you change your thinking about it? Like you just said, I changed my thinking about it. I did a 180. How do you change the story here from this idea of like a scarcity mindset to an abundance mindset? Okay,
Right.
well, I can't have this, but well, I live in New York, so how fortunate am I to have the best fertility treatment maybe in the world right here at my fingertips? It's a sort of change the story, change the
Right.
narrative.
Change the narrative
Yeah,
of what you're going through. And I think that can really help you psychologically and just kind of change your
yes.
journey a little bit
Mm-hmm.
to
Yep.
where you're not feeling sorry, and you're not feeling upset, and you're kind of feeling empowered that,
Yes.
I'm at this point, but I got this. I can do
Yeah.
this.
The antidote to depression and helplessness is action, movement and action. And I really recommend movement for
You
my
like
patients. I do a
meditation?
lot. Yeah. I do a lot of body work. Meditation is one of them. Things like tapping. I don't know if you guys ever talk
I've
about
heard about
tapping.
that.
Yes.
Tell me
The
about
emotion.
that.
Well, it's something called the emotion freedom technique, EFT. Um, and it's, I think they're not quite sure exactly how it works, but the theory being that when you stimulate, um, it's like the dual stimulation parts, these sort of energy release points. I think it's based in Eastern philosophy, like acupressure points. So it goes along with a sort of uh, complementary
Right.
um, techniques that if you stimulate these points while you're talking about out loud a difficult feeling, say anxiety, that it releases the feeling. It sort of really dials down whatever that feeling is. So I
Interesting.
think there are 9 points, and there's a way to, you do a whole setup statement. It's very simple and easy. It looks kind of strange, but, but that's the theory that it um, releases the intensity of that energy. And I have to tell you, I've done it myself. I've taught it to a lot of people. It really works. And just because there's no real like it hasn't been studied scientifically rigorously with, double blind studies and whatever, doesn't mean it
Right.
doesn't work.
That's right. And if
Yeah,
any technique works that helps calm the nervous system, that just
that's
kind
right.
of
Exactly.
refocuses your anxiety, I guess.
Yeah. So a
That's
lot of
all you
breathing. Yep. A lot of breathing, a lot of, soothing practices, any kind of mindfulness. Be mindful walking, mindful, washing your dishes. Anytime you can be mindful is a moment where you're going to calm your nervous system.
see that those are the techniques that I think are really important
Yeah.
because like I said, your emotions are so high, especially being on all the medications that we would be
Yes.
on.
That's right.
The minute anybody says the wrong thing, you can go off on another loop on something
Yeah.
else, but that's normal and that's
Of course. Yeah.
understandable. And I think
Yep.
having techniques to kind of calm that down, to know that, you're 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 thinking this way because of A, B, C, and
Yeah.
D.
Yeah. And there are many,
Breathe
many
and think
strategies
about
to
it.
calm. There are many strategies to calm the nervous system. Some of it is how you think, because
Right.
how you think directly impacts your mood. And people going through this process feel a lot like they're at the mercy of it, the mercy of, they
True.
don't, and the one thing you always have control over is how you think. You can always choose another thought.
I mean, look, with one thing in the group recently, with Mother's Day coming up,
Yeah.
May is a tough month for
Mhm.
a lot of
Yeah.
people in the community, which I understand.
Hmm.
I knew it always got me, while I was going through this process, and I'd be out with my parents and it was always a little stressful, um, especially getting the stress from the parents
Yeah.
about, what was going on and when, and, are
Hmm.
you guys trying and
Yeah.
everything else. So, on top of all of that, I know it's an extremely stressful time of year.
Yes. Yeah. So I
Um,
think it's important for people to notice the cycle of things and anticipate. You can reduce overwhelming feelings by labeling them and anticipating a little bit. Not, I mean, you can't get rid of them. You're
right,
still going to feel sad on Mother's Day or feel angry, whatever on Mother's Day. You're going to have feelings. But if you can anticipate it and ask yourself, what do I need? What do I need
to get through.
that day? What do I need? Maybe you need to shut it down. Maybe you need to just put on old movies in your jammies and don't do anything and say,
Right.
I cannot face the world today. Okay, fine. Maybe I need to tell some friends or ask some friends to check in with me. You can make a plan, then you feel like you're doing something. It's that same idea of taking action. And it's not perfect. Nothing's perfect. but it
No,
helps.
it's not, and it definitely helps getting through the holidays and
Yeah,
all these times a year,
yeah,
whether it's Mother's Day or Christmas, which was a big one.
yeah,
It's tough, all and family parties, and especially with all the you know events coming up in May and June, it gets
yeah.
very hectic, and it
Right.
gets tough. And I just think,
Hmm.
it's almost like every summer, oh, it's another summer and another year
That's right. Yeah.
of
And
going
also
through it.
that's right. And having those mixed feelings, to have someone validate it. Having mixed feelings is part of life. Like two things can be true at the
That's
same time.
right.
You go to your best friend's baby's christening
Oh,
and you're so happy for her,
but you're
but so sad for
dying
you.
inside, and
Yes,
you really don't want to be there because we've
right.
all been there. And
Exactly.
I've
Yep.
told people before, like I had a cousin every 5 minutes, she'd
Yeah.
be popping a baby out, and it
Yeah.
was so frustrating,
Yeah.
and it was like to the point where I remember saying, to my husband, I don't want to go, like
Right.
it's too
Right.
much,
And
it's
I'm sure you were happy for her
so
at the same
happy,
time,
so
but
happy, but
that's, yeah,
you can't help those feelings no matter what
right.
you do or say,
That's
they're
right.
gonna come at you.
Yeah,
And
that's right.
that's, and that's again another reason why I've grown the site, because I wanted a place where people could just come and vent,
Yes,
that they
that's
didn't
great.
have to worry about, you know, providers see what they're saying, or, I wanted a
Yeah,
free space where they felt comfortable to say things that they might not even want to say to you,
that's right. And this
you
this
know.
idea of, again, it kind of goes back to that shame feeling, like, oh, am I a bad person because I don't want to be at this first birthday party of my cousin's kid? Am I bad? Is there something wrong with me that I can't stand being here? But no, there's nothing wrong with you. And so to have a place to be able to hear other people say, oh, I have that feeling too.
What advice can you give to the husbands that are
Yeah,
going through this, the often forgotten part of this whole
yeah,
process? And I don't even want to say husbands, I want to say significant others.
yeah,
No matter who it is, whether it's your husband, significant other, partner,
yeah. I
what
mean,
can you
it's,
say to maybe help them understand the process and how they can maybe help?
yeah. I mean, I think it's so case by case. I mean, I don't want to dodge the
Right.
question, but
No, I
I
understand.
think, the one thing I always encourage partners to ask each other, which is, I mean, what do you need right now? How can I be of help?
Right. Just to
You
listen.
know, you know, yeah, exactly. Give them the opportunity to say, you know what, nothing right now, or I just need a hug. Um, and if you ask the question, that's very respectful, and instead of just pushing it, I think you need to do X, or why don't you just do Y, or giving some, oh, we'll get through this. This is some sort of platitude, or ask the question, what do you need right now? And the other thing is to be sure the partners say what they need, because they're
I'm
going
sure it's
through this
just as
too and they
stressful,
feel helpless. Yes.
because I'm
Even
sure in
more
the
so,
back of their
maybe.
mind, they're just as stressed because maybe
That's
they
right.
think it's them.
That's right. Yeah.
And
And
they
sometimes it
maybe
is them.
take that, yeah, and maybe they take that in their own way. So I think
Yeah.
maybe even just listening, being a good listener,
Hmm.
just,
Yeah. Yep.
you know,
Being a good listener. And I also think partners can help each other remember that this is not the sum of who they are.
right,
It's part. I mean, this is
chapter,
a big part, but go have fun. Do the things you like. Find the things you feel confident in,
right.
and that will actually help the other piece of it, because it can become completely consuming.
Right.
And it's hard not to. Every day you're going for monitoring or this or that. It's so in your face,
Right.
but it's not, it doesn't define you,
That's right. That's right. It doesn't define you.
it's
So
part.
it's part. So let me ask you a question about your practice. You're located in New York City.
Hmm.
Um, how do you see people? Where do you see people? You have an office?
At this point, I am virtual. I'm seeing
Okay.
mostly virtual. I
Okay.
have the opportunity to see people in person if that's, if they can't have, if they don't have privacy or whatever, I can do that. I can get office space. It's funny because after COVID, I decided to take a office for a few months just to see if anybody was interested in coming in. And most people were sort of like, when they figured they had to travel to me and then
Right.
travel back from me, they thought, okay, I'll do it virtually. So I
They
sort
got
of
used
stuck
to
with
Zoom.
virtual. Yeah. So I'm mostly that, but I'm willing to work with people
Oh,
on
okay.
that.
No, no, no. That's wonderful. Just so I know if people
Yeah.
where they live, if they can still see you virtually. So pretty
Mhm.
much no matter where anybody's located.
The only thing I can say is I can see anybody in New York State
Right.
virtually because there's licensure
Right.
issues for psychologists. I'm not sure what it is for other disciplines, but for psychology, there's a limit
Right. Of
to
course.
cross state. I am also licensed in New Jersey.
Oh, great to know
And
because we have a lot of members from, look, we have a
okay,
lot of members from everywhere, but especially in the Tri-County area.
right,
So
right,
that's wonderful to know.
right. And weirdly, I have virtual capacity in Florida. So if somebody's in
And
Florida,
we have Fertility Warriors in Florida too. So
okay,
that's so good to
yeah.
know. Well,
So those
listen,
three.
Dr. Somers, I am so happy that you joined us this morning.
Me too.
I
Thank you for
wanted
having
people
me.
to get to know you and your practice. I think, as I've said before, you know, uh, going to see someone going through this journey is so vitally important.
Mhm.
So thank you for
Thank
helping
you.
all of us, and we hope
Mm.
to have you back soon.
I would love to be back soon. And thank you for having me. I really appreciate it. And thank you for what you do. I think it's a really important community.
Thank you. Thank you, and have a wonderful day.
All right. Take care.